Hi, everybody. I'm really privileged today to be talking to Surbhi Kesar, Assistant Professor of Economics at Azim Premji University in India. And today we're going to be talking about work that she's been doing on the effects of COVID-19, the lockdown in India, on livelihoods. Hello, Surbhi, and welcome, and thanks very much for talking to us today.
Thanks, Henry. Thanks for having me. I'm very excited to be engaging with you on this topic, but rather a dismal topic, I would say. And we actually recently ran a survey of around 5,000 respondents across 12 major states in India in order to find out how is it that this lockdown has impacted, the population in the country. And particularly our focus was on the vulnerable groups of the economy.
So how did you actually carry out the survey?
So yeah, I think that's very interesting because right now it's all the surveys that were on ground have to be shifted to on-phone surveys, which of course makes the entire process very tricky because, as you can imagine, there have been a lot of studies that have come out in terms of talking about how do you even ensure consent on a phone survey, because in in-person survey you're talking about these issues, whereas this is you talking on phone with people, and the entire lines of consent become very murky. But we've tried to take all measures possible from our end and did a phone survey of people where we partnered with several civil society organizations in the country who have been engaged with these networks in terms of providing certain sort of helps or livelihoods to these people. And we were able to reach out to these civil society organizations, and they partnered with us in order to carry out the survey for these people. And to some of them,
just to be clear, they have the contacts with people and they bring them in so you can talk to them. So this is a survey. This is not filling in a form or anything like this. These are actual conversations. Is that right?
So this is basically based on a conversation where we train our enumerators. So what we do is we get the numbers from the civil society organizations, and they ensure that the people have consented to the survey, and we have our enumerators who basically then, based on a survey questionnaire, talk to these people and they answer the questions that we need from them.
And then you do the analysis.
Yes, exactly. And I think it was easier to reach out to these people through these civil society organizations because they know these people, most of them personally. Otherwise, I think in a pandemic, it's really hard to get people to talk about a lot of issues, especially when they're under so much stress with their economic and social conditions.
I can imagine. So what sort of results? This was back in June, you said, and what sort of results did you get there?
Yeah, so the lockdown mainly was from March 24th and much of April it was there, after which it was gradually being lifted at different places in different time. So the result was actually there was a complete devastation of livelihoods. What we found in our survey, which was mainly the vulnerable population, that around 67% of those who were working prior to the lockdown lost employment during the lockdown.
Right.
Yeah, but the figures I think are slightly better in terms of some results from other surveys, but it varies anything between 40 to 70% based on different surveys. Because if it varies in terms of the kind of population they've talked to, the region they have surveyed, ours was mainly concentrated on the vulnerable population, but that's kind of the range across surveys in terms of the intensity of loss of livelihoods.
So what does it mean if you lose your job? How does that affect people?
Right. So most of the jobs in our economy are actually informal jobs. That means that most of the time they do not have a secure written job contract, and they do not have all the social security benefits that comes with the jobs. That means, and a large proportion of our population actually depends on casual wage work, which is getting wages on a daily basis. So the moment you lose your jobs, you do not have any source of livelihood. And we actually tried to even find out that what has been the impact on, even things like access to food, access to daily essentials. And we found
Yeah.
like there was a huge proportion of population who reported that there is a decrease in the amount of food consumption. There were a majority of her sample actually reported that they did not even have a week's worth of money to buy essentials. So these are people who are living in such precarious conditions that they do not even have savings in order to sail them through. So the moment they lose their jobs, it directly reflects in their day-to-day living and just trying to get through the day.
So are people starving?
There was a marked decrease in the food intake. So one of the schemes that actually did work during the pandemic was, this. There's this already existing social cover in India, which is the public distribution system that started in India quite a few decades back, which actually ensures that there's a delivery of food grains, some basic food grains, to people who are below a particular level of income. So that's an already existing network in the country, and the government used that network in order to provide food to various people. That was one of the best functioning. Even that wasn't sufficient, and there was a lot of pressure that came from various activist groups and various other policy makers, think tanks and academics to increase the supply of that. In the absence of such a support, the amount of starvation would have been much more, and the amount of impact would actually have been much more. But that is also not nearly enough, because that's just access to particular kind of food grains, and there's so many other things that you need money and cash for, and most of these cash schemes did not work as one would have expected it to, because the cover was really thin.
So did people report hunger in the survey? Could you tell how many people were getting support from this scheme you were talking about, and who were being missed out?
Right. So I think one of the things to note here is that the question that we asked people was whether they, had a reduction in their food intake during the lockdown. And for that, we actually got around, let me check the number once again, but it was roughly around 80% of people reporting a reduction in their food intake. And that's how high the number was. As for this scheme, I think this scheme worked fairly well relative to other schemes that existed in the country, and it had quite a good cover. But as you can imagine, a lot of what they were getting was also not sufficient. So initially, the amount that was being provided under the scheme per household was low, which then there were a lot of voices in order to increase it. It was increased subsequently, but during the pandemic per se, there was actually quite, in spite of getting this sort of a support, there were a lot of people who were resorting to cutting down their food consumption just to kind of get through.
And do you know what's happened since that survey? What was the response to the survey that you got when you published it?
Actually, the response was overwhelming. It was carried in almost all big dailies, all national, local newspapers. There were a lot of other studies, that kind of came out based on our survey. But the the sad part of the entire thing was that we did not see a response coming from the government, what we asked for, or the policy advocacy work that we were doing based on the survey.
And
So
what
this
was
was
that? So what were you advocating?
So one of the biggest things that we were talking about was in terms of, first, of course, so there are a lot of other existing mechanisms that exist in the country, such as there's this thing about midday meals, which is basically all children going to the government schools are given an afternoon meal, so which incentivizes students to come to the school. Especially the people who are going to these public schools are people from very vulnerable households, and so it incentivizes those kids to go to the school. And on the other hand, it also provides them a nutritious meal. So we, along with other people like Jean Drees and Ritika Khera and other economists, have been advocating a delivery of these midday meals to people's homes. Then we at the center where we did this survey, the Center for Sustainable Employment at the Azim Premji University, we've been advocating for the longest time for an urban employment guarantee program, because now the lockdown has lifted, and even now, since your question was ever since then what has happened, of course a lot of people have joined back jobs, but that's also a sign of distress. Despite such high pandemic, people in our economy cannot resort to being unemployed for any amount of time, because a lot of them are informal workers. They need employment on a daily basis just to kind of get through. And so one of the things that we've been advocating is this rolling out of urban employment program. So India has a very strong Rural Employment Guarantee Act, which provides a minimum 100 days wage work of anyone looking for work. This is mainly unskilled work, but of course includes some skilled work as well, and the wages are low. But this is basically there to provide some guarantee of employment to anyone who's looking for work. We've been advocating for it to be extended to the urban areas where a lot of, this involves a lot of construction work as well. So this also helps building a lot of sustainable infrastructure in the urban areas, which is pretty much a requirement. So that's been one of the things that we've been advocating. We've also been advocating for increasing in this employment guarantee program that already runs in the rural areas. We've been asking for increasing in wages, which is not just us, but other, activists and academics have also been advocating for something along similar lines.
But there's been no response policy-wise to that.
No, so one of the biggest rollouts that they've kind of come up with has been this thing called Atmanirbhar Bharat, which actually translates to self-sufficient India, where they say that it's a stimulus package, but it's actually just a monetary sort of a measure, where what they're doing is decreasing the interest rates on the loans that they are willing to give out to small businesses. But that doesn't make sense at this current juncture, because when there is so much uncertainty in the economy, no person in their right mind would borrow and take a loan in order to set up a new business, right? Like that's Keynes 101. So that's the kind of measures that they're doing, which are of course not going to be effective.
So, well, recently you said that there's been another survey, I believe. And so what sort of results is that finding?
Right, so there's this survey that's come out from the Center for Monitoring Indian Economy, CMI. So we've been using their household survey data. And I think one thing that's very starkly coming out of it, it is a work that I've been doing with my colleague Rosa Abraham and Amit Basole, where the impact of this loss of employment that happens is actually very varied across social identities and occupational groups. So the impact has been way more on women than on men. The impact has been way more on socially backward castes, which include Dalits and other backward castes, relative to the forward castes, or those in quote unquote the upward social hierarchy of the economy. And I mean the upward social hierarchy. So it's actually been much more for them. If we look at particularly the urban areas, the impact, or rather the loss in employment, has been higher for Muslims than for Hindus, which is the majority community, as well as the other religious relative to other religious minorities. So Muslims have been the worst affected. And it's really, so if we then look at how this effect varies according to the type of employment. Let's say if you have a permanent salary job versus if you're a casual wage worker, of course the effect is much more in this casual wage or the informal work that characterizes a huge proportion of employment in the economy. But despite there being effects across these sort of different employment arrangements, in each of these, the impact is worse for women, for socially backward castes, and that's how it's been. In terms of, so they've recently come up with another round for August, which talks about the recovery. And what we find is that while there has been a good recovery for men in terms of those who lost employment, so how many of them are gaining employment back, but again, the effect is much worse for women. So there is a very strong gendered impact, caste-based impact of the lockdown and of the economic crisis induced by COVID-19.
Mm. And so we are continuously hearing increasing numbers of cases happening. How is that? Is there likely to be another lockdown, or how is that impacting on people?
So I think one of the worst thing that's happening in the country is that there's a complete, everybody's given up and the government's given up. There's earlier, just like a few weeks back, when you were traveling to different states, there were state-wise lockdowns that were happening. That meant, sorry, not state-wise lockdowns. There were state-wise quarantines that were happening. Or, you know, when you, let's say if I move from one state to another, every state had a quota where you would be put in either home isolation and you could not travel for 7 to 15 days till the time, even if you've contracted something during travel, you're not passing it on. But that's been completely lifted. As so it's that's why it makes it a really weird moment, because the time when the cases were much lower, there was this draconian lockdown that was imposed in a country like India, where so many people are literally living hand to mouth. And just one more thing that I want to note there is that that was the time when the lockdown was imposed with a 4-hour notice. And India has a huge population that migrates from rural areas to urban areas. And these are people who are working in really low skilled construction work and earning really low wages, who generally live on site. And when this lockdown was imposed, those people had nowhere to go to. The trains were stopped. Any sort of flights. I mean, they could not afford to travel by air, but trains, which is pretty much the lifeline of Indian travel, long distance travel, that was stopped entirely. And there were reports of many of these migrant workers actually walking thousands of kilometers just to get back home because they had no place to stay here. So that's what happened when it was practically what government did was doing nothing. That's what it did when the cases were so low and imposed that lockdown. And now when we are at such high cases, there are the social distance measures are not in place. There's no strong oversight. In some states now, there's actually been a strong drive of tracking and doing random testing, but that still is low. But I think even despite that, there are other measures that can be put in place. Right now, we also have this notice of opening schools and colleges from 1st of October in the state that I am in. And this is just going to make matters worse. It's a recipe for disaster.
Blimey. And what are what's the levels of deaths looking like, and how are the hospitals coping?
Right. So I do not have the death rate figures on me. So I'm not sure if I'll be able to tell you the exact death rate. Though the mortality rate in India, in terms of number of cases, has not been very high, but it's definitely now the second, it's already surpassed Brazil in terms of the number of COVID-19 cases, despite low testing. But in terms of the pressure on the health sector, the pressure is huge. So I think another thing that's happened in India is that there is a requirement for building health infrastructure. So, and the disparity is so huge. You go to these urban areas and urban centers, and there's a lot of private investment in health infrastructure, and private companies moving in and providing state of the art facilities. Whereas in the rural areas, all you have are some public health centers, and that too most of the times not equipped with the machines that you would need, even for the infrastructure you would need for some really basic lifestyle illnesses that might exist. So again, what the government has tried to roll in is an insurance based scheme where where people are now the health insurance is something that is being provided. But I think one of the strongest points that India had for the longest time was that its health and education, especially higher education, was completely publicly supported. And it had been, and that was one of the very important backbones of the country. But increasingly, what has started happening is that there's this drive towards privatization because privates is considered more efficient. And so it's more insurance based policies that are being rolled in. But even if people do have insurance and they do not have access to basic healthcare in where they are staying, somebody has a heart attack, you have to transport them for hundreds of kilometers, there's a very likely chance that the person wouldn't make it. So this is now getting reflected in terms of the current pandemic as well, where the infrastructure is not sufficient to deal with this, and it's just becoming worse by the day. There's so many people who are infected and are still looking for beds to be available in the hospital so that they can shift in, even if they are experiencing discomfort in breathing.
So is the government's decided that the lockdown didn't work because the economic impacts were worse than the pandemic, and so are now just saying, well, they'll just have to let the pandemic rip, and because they can't afford to close the economy down?
Pretty much. I think in an economy like India, maybe just even imposing the lockdown is not an option. I think there were if it had to be locked down, it had to be locked down in very specific areas. There had to be, sort of a zone defense, and not really a complete draconian lockdown of the kind that happened. And now when they knew that the economy wasn't able to deal with it, what has been done is a complete sort of, the measures are being floundered day in and day out, and the government is not really stepping in to do anything about it. So yeah, I agree with you that the economic aspect of it is really important. So one cannot impose lockdown of the kind that they did at the first place. But that's the entire thing. It had to be a strategized lockdown, and it had to be a strategized, lifting of the lockdown as well. And none of that has happened. So what really has happened is basically doing nothing. You could afford to do nothing because there was a lockdown. And now, since the lockdown is uplifted, again, what you're doing is nothing. That's pretty much how it has panned out.
And what about, I understand that in India, there are powers at the state level rather than the federal level. Have states acted in a different way in different places?
So,
are there any states that are doing better?
Yeah. So yes, so the performance has actually varied quite a bit from state to state because it's a federal structure. But now increasingly, the central government owes money to the state, which it is not, the funds are not being released. And that makes it even tricky for the state governments to be dealing it on their own, especially when they are under such a huge financial burden. But in terms of how the states are performing right now, I think currently the situation is quite bad. But in the past, states like Kerala, they're now experiencing so the cases in Kerala, which is the southernmost state of the country, had gone down, but it's on the rise again though. However, the policies that they put in place, because of which they were able to control this for the longest time, were extremely effective. And what they did was contact tracing, they did random testing, they actually something that very interesting and innovative that happened was, at this point of time when a lot of schooling is happening online, a lot of people might not have access to laptops and other sort of ways via which you can access your classrooms. And they provided laptops to students from below a particular income bracket. They started running television programs for children, which was about learning and holding science and other lessons through television. Like, they've come up with really innovative solutions. The social distancing measures were very strong and in place. They've really kind of been, in that sense, some sort of a model for the other states to follow. However, India is now at a level where the cases are rising again everywhere. But I think I would say I'm not a person who would know the trajectory of the pandemic well, but I think if something has worked in the past, it's been those measures, and that's what kind of needs to be done again. And of course, in Kerala, the income support was way stronger than in the other parts of the country.
So it was possible.
Yes.
Kerala showed it was possible to take action.
Yes, it was definitely possible. We are hoping to see that such success cases again stand out, so that the other parts of the country have some model to follow. So it's not that nothing is possible, because that's kind of the impression that is being peddled in the popular media, that look, the country is so huge, the economic impacts are so huge, so we can't afford to do it. But even if we can't afford to lock down, there are other measures that can be taken in order to, even if not, find a way out of this, but at least to deal with this better. And that's what the country as a whole, or rather, most of the country has been failing to do.
Because I was reading just recently that one of the leading countries in terms of responding to COVID-19 is actually Senegal in Africa. So we can, we jump to these conclusions that it's impossible to do anything in poorer countries, but it doesn't seem to be the case, that it's maybe about the will and competency of governments. So is there a backlash against the government? I mean, obviously a similar sort of situation seems to be in the US, and we'll see in November how the election plays out there. But what about India? Is the government vulnerable?
So I think that's a very interesting question. So I think I'll respond to two things. One, when you gave this example of Senegal, so we are diversifying and decolonizing economics. We actually we did a seminar of, or rather a sort of a webinar on success stories from COVID-19, of COVID-19 from the global South, because, we're still in a point where we're looking for models to be in the global North in terms of guiding how to go through it. But we did an interesting sort of roundtable with people from Vietnam, one person who talked about so India is such a huge country that every state can be pretty much one European country, right? It's a pluralist nation sort of a thing. So basically, but when we looked at the experience of Kerala, Cuba, Argentina, and Vietnam, we were discussing of how these really innovative solutions existed, which these economies, despite having a lot of financial constraints, have been able to take up and have actually performed in certain measures even better than their countries in the global North. I don't know the current Vietnam figures, but at the time when we had this webinar, there was one death in Vietnam due to the entire pandemic. Yes. So that's kind of the how Vietnam has a very, I think so there are two kinds of responses, right? One is the immediate the health response, and the other is the economic response. Those are the two planes at which the responses are working. So Vietnam has a very strong health infrastructure, already existing health infrastructure. So a lot of the economies where the conditions have been extremely bad has also exposed this lacking of a strong health infrastructure in those economies as well. So going to your point in terms of the response to the government or the impact. So the Indian government or the current ruling party has a lot of popular support. I would be very surprised if an election were to happen in India in November, that the tables would be turned. And that's what makes it really worrying in the sense that despite all this happening in the country, the popular support, even if diluted, has not at all gone away. In fact, what has been increasingly happening is that India now also has border issues with China, and there's a lot of tension going on in the Ladakh region of the country. And despite all that, the popular support has kind of remained with the ruling government. And people, it's fascinating that the mainstream news channels, most of them, what goes on from morning to evening have been these cases which stand nowhere relative to the crisis, that the economy crisis that in the entire country is in. But they don't even make it to the primetime news, because there's a complete, so Chomsky talks about this very interesting media and political nexus, where he describes that what role media plays in forming the popular discourse. And you see that such playing out, such an intricate dance of that playing out in the Indian economy, how the media and the power and how the public discourse is being shaped. It's almost like there are two sets of people living in alternate parallel universe, seeing the same thing, but observing two completely different things out of it.
So is this partly because if you are part of the middle class in India, you're able to cope and you're not badly affected. So the sort of elite, if you like, who control the media, obviously politics and so on, actually don't see themselves as being badly affected and therefore ignore the effects on the poorer people.
So in India, what we call the elite, or what we even call the middle class, that its median is very different from its average. It's very unequal country, right? So
Yeah.
in order to, in a democracy, even if it's, populist or however, one cannot win elections unless there is popular support. So that definitely means having support across income groups. So one thing is, yes, so there is this corporate media and power political nexus that exists, which means that there will be certain powerful and certain, richer and elite creamy sections of the economy which will be controlling a lot of the media houses, and therefore, that's the truth that they want to show kind of gets reflected there. But on the other hand, it is not that the people who are affected are not still supporting the ruling government.
All
And
right.
that's what makes it, that's what makes it very. So Arundhati Roy, in one of her articles, had written, I'm just going to paraphrase, and I can't, of course, remember what she said, and she writes beautifully. So what she says is how the power how those in power in our country might be very relaxed, knowing that our country has such a huge resilience in terms of not reacting, in terms of not speaking against all that's going bad. And I think that does give a lot of solace to those in power, that you can keep pushing the boundaries of people's patience, and still knowing that they're not going to react must make it a very sort of, peaceful sort of way of making things work.
Is that because people have very low expectations, effectively? Or that they see that this is a sort of God, a sort of, it's not the fault of the government, it's like happened due to a sort of God intervention or.
So yeah, so that's an interesting question, because so I think there are a few factors at play, and I can of course speak to the best of my understanding of it, and I might be missing out a lot of aspects of it. So one thing that's there is that this country does has popular support from various, sort of economic strata of the population. Another thing is that Indian politics, or I don't know, elsewhere as well, maybe, it's not just dependent on the material conditions of the people. For example, there was this time when the lockdown was being imposed, and there was this entire sort of, hullabaloo about whether the Prime Minister came to the news channel and asked people to light candles at night in order to, support the frontline workers and, come together in solidarity. As a thing, it's yeah, yes, it's very empowering, and that is something that's, yes, we are grateful to our frontline workers. But on the other hand, while you do that, you cannot stop questioning what the government is doing wrong. And that's exactly what's been happening in the country. There are people who cannot sometimes afford food, but will make sure to go and buy the candle because the government has asked to do so, and light it because that's what you have to do. So I think there are two factors at play. One, in terms of, there has been this formation of image of the leaders as the patriarch, who are kind of going to, who are these godly figures that we are supposed to follow without question.
Yeah.
And an unquestioning democracy is not a democracy. And that's what we are landing into now, that we want uncritical thinkers. So what, in his book, The Great Transformation, at one time mentions that he's saying that, you can't really treat humans as like lemmings marching off the cliff. But I almost feel like there are people who are like lemmings marching off the cliff because they've imposed their entire trust with the government. And I think second very important thing that has happened is that there has been, over the past few years, this constant creation of a caricature of a villain that probably doesn't even exist. So for India, as you would have seen, that what had happened is this in the Citizenship Amendment Bill that came in just before, a few months before the COVID-19 pandemic happened, and there was a long stretched movement that had been going on protesting against the bill, which kind of questioned the secular ethics of the Indian constitution. So all that had been happening, but and recently Kashmir's autonomy was diluted by the dilution of Article 370. All that has been happening, but what happens parallel to that discourse is that a constant caricature is being created who is imposed as the villain for the entire the entire population to direct their anger towards. In the Kashmir case, which is a struggle for autonomy, it's a Muslim who is shown as the caricature of this sort of villain, or it's Pakistan, or it's X, Y, Z, and this just keeps happening. So people just find other sort
I lost you when you were talking about finding people, caricatures of people to blame.
Yes. Sorry, I lost you as well. I don't know why the Zoom crashed. So what I'm saying is certain identities or certain aspects are always being created as these caricatures of villains that people can direct their anger towards. And it's possible in a country like India because it's pretty much a place with such diverse social identities that constantly that's being done. And I think as economists, we need to engage with these aspects very seriously, that finally it's not just the material conditions, as important as they are. What we generally tend to classify as the non-economic factors are really not non-economics, because these identities vary according to, or the economic strata reflects various identities as well. So there is that need to constantly engage with these as well in our analysis.
Well, I think we have it as well. They're called the culture wars, and it's what Trump. So that people actually try and divert the debate from the material situation to culture wars and setting up different sets of people against each other. And it's certainly, there are suggestions that our government in the UK is aiming in that direction. And obviously Trump in the US is doing that. So maybe this is the phenomenon that we're seeing, where this is used as a diversionary tactic to separate people out who might actually have commonalities, to maintain it's a sort of old style divide and rule.
Yeah, so I think it's also a very interesting moment throughout the global history, because we are seeing a lot of similarities of things, the way this popular narrative is being constructed throughout the world. But I think what really scares me about India is that the proportion of people questioning it is probably not as much as it is in other countries. And these are people, educated people, I shouldn't say educated, but literate people working in, otherwise, probably a few years back, very liberal, sort of liberal in the US context of liberal people with liberal ideas and ethos, and they have come out and become very radicalized in a very right-wing sort of sense. And I think it's also a problem of increased lack of engagement across the two camps in India, that there's been so much polarization that, and like, I think the artificial intelligence and all the social media doesn't make it easy either, because the way the algorithms would work is that if I tend to like a particular tweet, or if I tend to like a particular link, I'm more likely to get, have more such news come to me. So there's a constant feeding happening in our own echo chambers, where those who hold a particular viewpoint are constantly talking to the people who hold similar viewpoints. So it's increasingly becoming more and more polarized with not much option or possibility to communicate across.
Well, at least I'm really glad, Surbhi, that you are trying to challenge this lack of analysis and try and create a sensible dialogue about it. And I wish you all the best in doing that. And thank you very much for talking to us today. And hopefully we'll be able to catch up maybe in a few months' time and see how things are going. And I hope things go somewhat better.
Thanks, Henry. Yes, it was great engaging with you on this. And yes, I do hope as well when we talk next, things are better. Thanks a lot.